What is evidence? Evidence is everything that is used to reveal and determine the truth. Medical evidence comprises medical knowledge from clinical trials and published research to reveal the truth about medical conditions and the safest and most effective treatments. Let's take a look at how we use evidence on a daily basis to better understand exactly what evidence is. Have you ever ordered a flight online and looked at one of these sites? These sites give you evidence about flight information. You type in your departure city, your destination city, and the date you want to travel, and these sites enable you to see the cost of each flight. In addition to the cost, you can see when it leaves, from what terminal it leaves, how long the flight takes. All of this information is evidence. Have you ever looked at this site when you were preparing to buy a house? You type in the area where you would like to purchase a house, and then this website gives you all the evidence about the listings, the number of bedrooms, the number of bathrooms, the property type, the square footage, if there's going to be an open house, what year it was built, if there's a parking garage, how many cars can fit, the lot size, and so on. Has anyone ever used this site, E-Trade? It gives you all the evidence on different stocks and bonds so you can find out where you want to invest and how to best save your money. Consumer Reports, another site full of evidence. They take reviews and studies and give products scores. This is an example of insect repellent. Consumer Reports gives you the cost, the active ingredient, and the overall score. Additionally, you're given the effectiveness. All of this information is evidence. I hope by now you realize that you use evidence quite often to book travel, buy tickets, even help save and invest our money. So why don't we use evidence for medical reasons? You think it's not possible? You think it's too hard to understand? Well, the Cure is here to show you that it's not. The Cure's technologies enable anybody who can read and do basic math skills to understand medical evidence and use it for their benefit. Here's an example of evidence from The Cure. This is called a study summary. What a study summary does is gives you all the evidence or information from a clinical trial that's used in your personalized database. This is an example of an article from the Localized Prostate Cancer Database. You can see that you have the title of the article. In addition, you have the study profile, which tells you the study design, the sub-design, the years the study was conducted, and some additional information. You are also given patient characteristics. It's as though each study is like a virtual waiting room. You walk into the waiting room of this study, and you're able to see how many participants were in the study, what their age was, is it like your age, what their gender is it the same as yours, and what their diagnostics are. PSA score is a score particular to prostate cancer. And if you have prostate cancer, you're likely interested in people's results that have the same PSA as you do. You are also given study outcomes. You can see that in the open radical prostatectomy group, after 13.3 years, 6% or 36 participants died due to prostate cancer, while in the treatment group that had no treatment or active surveillance, after 13.3 years, 16% of them, or 18 participants, died due to prostate cancer. This is another example of evidence used by The Cure. This is our meta-analysis tool. This graph shows mortality. You can see that in the open radical prostatectomy group, there are 4,200 patients. Out of all of those patients, 642 of them died due to prostate cancer. While in the comparator group, which in this case is no treatment or active surveillance, there were 2,300 patients. And in a mean follow-up of 8 to 20 years, 1,124 of them died due to prostate cancer. You can use this medical evidence to help dictate your treatment. You can take this to your doctor and talk to them about what you think is best for you based on your age, your background, and other important factors.